Hello, everyone, and welcome to this episode of the Fortcast, the official podcast of Fort Healthcare. I am your host, Dr. Michael Anderson. Thank you for joining us today. And today's topic I'm very excited about. We are going to discuss what a CRNA is. We get a lot of questions on this. Our surgeons get questions on this. And we are very fortunate to have just an absolute incredible CRNA group that work here at Fort Healthcare. And joining me today is the head of that group, Jeff Skihoski. So Jeff, thank you very much for joining me on this episode of the Fortcast.
Thank you. Glad to be here.
Before we get started on the topic, most of our listeners know I've been with Fort Healthcare for a little over 2 decades. And if you could just tell us a little bit about your background and how long you've been with Fort Healthcare.
I've been with Fort Healthcare. This is just into my 8th year. I've been practicing as a CRNA for just into my 26th year. I worked in a North Chicago suburb before coming to Fort Healthcare, and I landed on my dream job.
Well, that's wonderful to hear, and it's been a dream to have you. For those that don't know, Jeff is our director of anesthesia, so he really helps the day-to-day functioning of our operating room, which every single surgeon really appreciates. And then also Jeff sits on the Fort Healthcare board, so he brings a lot of leadership to our team and really is a wonderful producer and asset for Fort Healthcare. Jeff, our patients and our community benefit so much from your involvement. So I definitely want to thank you for that. We are definitely a stronger organization with your help. So I'd like to get right into the topic, Jeff. So we'll just start with the CRNA initials. So what does that stand for? What is a CRNA?
So stands for Certified Registered Nurse Anesthetist.
Gotcha. And how is that different than an anesthesiologist?
So the main difference is how we acquire our education. So as an MD anesthesiologist, you go to undergrad, medical school, and then residency, which trains you specifically for anesthesia. A CRNA goes to 4-year undergrad as a nurse. And then after nursing school, there's a minimum requirement of 2 years of some sort of critical care experience. And then you apply to anesthesia school, which is a 3-year program. And you come out of that 3-year training with a doctorate of anesthesia.
Yeah, so it's a long process. I mean, it sounded like it was a 9-year process if you go right out of high school.
Correct.
For our listeners, it's important for me to provide the information that Fort Healthcare has been a CRNA-only group for decades, at least 40 years. And like I said, they are an extremely well-oiled machine. They do an amazing job for our community and our patients. And Jeff, you leading this group has just been wonderful. So as somebody who is a CRNA, are your services any different than an anesthesiologist? What you can offer our patients in our community and what we do here at Fort Healthcare in our operating room, is it any different than an anesthesiologist?
If you ask various groups of anesthesia providers, everyone will tell you that there are differences. And in the day-to-day practice, there are minimal. We do everything here at Fort Healthcare that an anesthesiologist would do at other hospitals. We do bread and butter type surgeries. We don't do open heart surgeries or neuro head cases, but those bigger cases, transplants, some trauma, open heart surgery, and neuro cases that we don't do here, definitely probably do better with an anesthesiologist because their training a lot of times includes fellowships in those specialties. But in the day-to-day practice of elective regular surgeries, there is very little difference.
Yeah, community-based medicine, there's a lot of community healthcare systems that have CRNA-only models throughout the state of Wisconsin. Because, correct me if I'm wrong, Jeff, but a CRNA is considered an independent practitioner. You don't need the supervision of an anesthesiologist. Is that correct?
That is correct in the state of Wisconsin.
And I think, I don't want to speak for our surgeons, but I feel our surgeons are just incredibly thankful to our CRNA team. They do a fantastic job. I've had, even as an ear, nose, and throat doc, some very complex airway cases, and our CRNA team has just done a wonderful job securing the airway. And I don't want to make light of the fact how important your team is. Tell me a little bit about your role in OB also, because a lot of times we think of CRNAs as just in the OR exclusively, but we at Ford Healthcare, the CRNA group actually expands beyond just our operating room. So can you talk a little bit about that?
Yeah. So in our training, we spend time in every specialty. We actually do the neuro head cases, we do open heart surgeries, we do trauma. So there isn't anything that we aren't trained to do. And one of the specialties that causes a lot of stress or people's desire to do it or not do it is OB. And so we're all trained to do OB. We do epidurals, we do C-sections, we take care of and resuscitate premature babies in preparation for transferring them to a neonatal ICU if they're unfortunate to have to deliver early here. So we handle everything that any other hospital would handle. We don't ultimately take care of that patient start to finish till the end of their discharge because we don't have a neonatal ICU, but we take care of the moms comprehensively, including not just the epidurals or spinals, but we also are involved in pain management, which is kind of the new latest and greatest thing for anesthesia and CRNAs.
Yeah, and I know your group has been very progressive. Previously, I did an episode of the Forecast with one of your teammates, Jonathan, about the COOLIEF and total knee treatment, which was wonderful. And I think I want to highlight a couple of things that you said. So you provide full OB anesthesia services. If we have a code blue in the hospital, whether it's a neonate or even an adult, it's always incredibly helpful to have a CRNA at the bedside to assist in that code. Now, we at Ford Healthcare believe in having a very progressive, forward-thinking group with our CRNAs. They have done some wonderful things. They've added services that our community has needed. And one of those is pain management. And it started with just our total joint program, with basically total knees. And you have a team member that is now fellowship trained. Is that right, Jeff?
That is correct. One of my partners went and did a year-long, after his anesthesia training, but a year-long specialization in chronic pain management. And he's become yet another resource for us on the team for managing pain.
And I understand you have another team member that's interested in potentially doing the fellowship?
Yes. Jonathan, who you talked about and who set up our knee ablation program, is also interested in the pain track, which is a year-long fellowship.
And that program has been wildly successful, has it not?
It has been. So just to kind of step back a little bit for all the people, through the years, we learned slowly that opioids for pain management has not really served us very well and gotten a lot of people in trouble. So over, I would say, the last 5 to 10 years, we've worked very hard to change our practice. Everybody knows when you have surgery, you have pain, right? So we've worked real hard to change what we've done or what we do for patients. And we have developed a very comprehensive nerve block program, ultrasound guided, and depending on the area where they're having surgery, we target those nerves that would basically cause or collect the pain from the surgery, and we block those nerves with local anesthetics. So think about the dentist, and they make part of your mouth numb so they can work on a tooth. Well, we do the same thing with a body part. If it's your arm, we make your arm. If it's your shoulder, we take care of your shoulder. And hence the total knees was one of our greatest pain causers. So as a practice and as a group, we're probably 80% opiate free in this practice. If patients still have pain, we give it to them. but we try really hard to use the nerve blocks and local anesthetics to reduce or eliminate the narcotics, which cause so many problems for people.
That's an incredible stat, that just the reduction in opioid use. There's so many secondary problems with opiates that really we rely on our anesthesia colleagues, such as you and your team, to really reduce the postoperative need for opioids. And really, you mentioned your block program. And when I always think about your block program and how successful it is, and the number of blocks that you and your group perform a year, that really opened the door to a couple of teaching institutions that reached out. And Ford Healthcare is actually an integral partner with a couple of these schools to train their CRNAs that are in their residencies. So, can you speak? Because I'm very proud of that, and I'm very proud of your group. It says one thing to do what you do really well. It's another thing to do what you do really well and then get noticed by the academic world and have the academic world say, hey, we want to be a piece of this. How can we get our CRNAs that are in training part of your program? Because you have something really, really valuable to teach them. And if you could talk a little bit about that over the last several years, how that has grown, Jeff.
Yeah, so about 6 or 7 years ago, we reached out to UW Oshkosh, who has an anesthesia program, and we wanted to partner with them and bring their students here because we felt we had a lot to offer in rural medicine, especially with our nerve block program, because we're doing on average probably 12 to 1,500 blocks a year.
That's a huge number.
Which is a huge number, which goes along with the 80% opiate free. So we reached out to UW. We came to an agreement to bring their students here. We wanted senior level students from the 3-year program. So they come here for 2 months at a time, and we give them a very intensive training program and very specifically or hardcore on the nerve block program. So it's been absolutely tremendous. We've had the mindset that we're only as good as our future, right? So we brought these students here and we've been training them. And right after we brought the Oshkosh people here, Marquette University in Milwaukee started a program, and they reached out and wanted to bring their students here. But I felt like I needed to get our feet on the ground and make sure that what we were advertising, we were going to provide to these students and make sure that our abilities were good. So we had probably close to 4 years of, and it was a little bit of a skewed time because COVID happened, but we kept students through COVID. We wanted them to experience what we were struggling with or dealing with during COVID. And then once we were sure and felt comfortable and the education that we were providing was truly awesome, I reached out to Marquette, and we now have Marquette students coming here for the last year and a half-ish. And good news, there's yet another program coming to Wisconsin at Edgewood College and in Madison, and they know of our affiliations with UW and Marquette and know how good this program is for providing the nerve block experience, because not every place or hospital or program is doing it, especially doing it like we're doing it. And so they've reached out with an interest as their program comes online, and students to the senior level, they're already asking if we have an interest in taking on a third institution in training. And I feel fairly confident that we can provide that to them because of the number of blocks that we're doing every day.
That's 3 academic institutions in the state of Wisconsin that have reached out. 2 of them have current students rotating with your teams. And the other thing I should mention is we do a lot of pediatrics at Ford Healthcare, which isn't common amongst community-based healthcare systems. Obviously, ENT, that's near and dear to my heart with our tonsillectomies and tubes. And that's another huge area that your students get exposure to that they may not receive at other places, is the community-based pediatric anesthesia.
Yeah, that's correct. So out of all of the training through anesthesia school and even going into practice, you either love pediatrics or you hate pediatrics, because there are really subtle differences between the two, and everything is just a lot smaller and happens a lot faster with a child. And so you're right. Not a lot of rural hospitals spend a lot of time doing pediatrics. They send them to the bigger hospitals in the bigger cities. And we've always had healthy pediatric patients here. And in my previous life at my former employer, we did probably 3 or 4 rooms every day, all day with peds. And I spent an enormous amount of time most weeks doing pediatrics. And so I loved pediatrics. When I was an undergrad registered nurse, that was where I wanted to go, pediatric ICU, until I found out that I was sick with something different every day, with these kids being a little petri dishes. So when I moved to anesthesia, it was a way to get back to pediatrics. And it's the patient population that I love. So bringing my skills from my previous life to Fort Healthcare has been incredibly rewarding. And then being able to pass it on to our training CRNAs has been very invaluable. And I think we offer the ability for these students to get the repetition and experience, and to some degree a comfort level taking care of these patients. And so I think it's great on both sides.
And I would agree wholeheartedly. You definitely fall into the camp of you love pediatrics, which has been wonderful for us in supporting our pediatric surgical patients. We do so many peds cases, and we have a pediatric team upstairs on the inpatient ward that Fort Healthcare is very dedicated to its pediatric population. And that is a differentiator. As you mentioned, a lot of community-based, especially rural-based healthcare systems, they will shy a little bit away from pediatrics. But for us to have a CRNA team that does pediatrics as well as you and your team does is truly a gift. I mean, you mentioned the neonatal resuscitations, that if we are forced to have to do that in our OB unit, your team does just an amazing job with that, stabilizing the youngest of the young for transport to neonatal teams or neonatal ICU at our academic tertiary care centers. You really do an incredible job. So in summary, I'd like to say the CRNA team is absolutely fabulous at Fort Healthcare. We couldn't pick a better partner in our operative endeavors for our patients in our community. You have the absolute trust of all of our surgeons. We've had a CRNA-led anesthesia team for decades, and your services continue to grow, which is just absolutely wonderful to see, Jeff. You're always thinking about tomorrow. You have the academic involvement at this point. Your team is progressive enough and has the skill where academic institutions want to rotate here at Fort Healthcare to teach the next generation of CRNAs. And I just can't thank you enough for not only being on this episode of the Forecast, but really doing the services that you do for our patients in our community. It's truly remarkable.
It's a dream job, like I said at the start, and I love coming to work every day. We do great things. We're very progressive, as you said, and I have great people around me. We're very collaborative, and we like coming to work.
Your whole team is just amazing. So thank you for your leadership. And I look forward to working with you for years and years to come. So we got lots more people to take care of.
That sounds good to me.
Well, I hope you all enjoyed this episode of the Forecast. Please share it on your social channels. And to see our complete library of episodes of the Forecast, please do not hesitate to look on our website, as you can find our complete library at that location. Other than that, this is Dr. Michael Anderson signing off on this episode of the Forecast. Thanks for joining us, and I want to thank Jeff for joining us as well. So have a great rest of your day. Take care. So long.